Right. Good afternoon and welcome to Kaweah Health's Community Engagement webinar. Today is Thursday, November 4th. My name is Deborah Volleson and I am the Director of Community Engagement. Today's webinar is going to be a little different as we are also streaming live on Facebook and using this session as a media and community briefing. Since we are in a more expanded platform, I just want to remind everyone that Kaweah Health is not a political organization. We are a healthcare system and we provide care to those who need it in our local community. So please be kind in your comments and in your questions and try to remember that our nurses and our doctors and our staff members are humans, and we are working hard to make sure that we give quality care to everyone who walks through our doors. Kaweah Health continues to be impacted by COVID-19, and we've been experiencing high inpatient census for the last several weeks and even months. That census reached a heightened level of crisis yesterday, and we're going to address questions around that during this event. It is always my honor to sit next to Gary Herbst, Kaweah Health CEO, and we love to educate our community about what is happening here at our local hospital. So Gary, you and I are both fully vaccinated, and we have another thing in common.
Yes.
We both have had COVID-19, so I feel pretty comfortable sitting next to you online without a mask.
And because we were fully vaccinated, when we did contract COVID, we had a very, very mild reaction to it. So.
Yes, well, It's good to see you and welcome.
Great, thank you. I was hoping that as you were describing or reminding folks of our nurses and our doctors and staff being humans, that you would have mentioned our CEO.
Oh, our CEO is human.
Yeah, so. But,
and words hurt.
Yes, but most CEOs have developed thick skin over the years. It's just a form of survival. So, But anyway, thank you to all of you for being here again, for joining us, our community engagement members, for joining us for our bi-weekly telecasts. Great to have you back, and then I want to welcome all of our expanded or extended community participating in this telecast today. It's very timely. As Deborah indicated, yesterday was the second time in just a short period of time over this Delta variant surge that we're experiencing that we actually had to declare an internal disaster or a code triage, which we'll talk about in more depth in a moment. But okay. I know you always like me to start out with kind of the numbers, and when we started these broadcasts over the last 18 months, we'd always start at the state level, then move to the county level, and then to the local level. And for the last few months, we've kind of disbanded with talking about the statewide, because we're definitely what we're experiencing, the conditions from county to county across the state's 58 counties are quite varied, as we'll kind of touch on today. So I think it's much more relevant for all of us, obviously, to talk about what's going on in our particular county and our community. So as of this morning, the Kaweah Health Medical Center here in downtown Visalia, we had 109 COVID positive inpatients, adults, all adults. We do not currently have any pediatric COVID patients. We have had a couple over the last few months, but they recovered quickly and were discharged quickly. But 109 COVID positive adult patients occupying beds, and then we had have an additional 2 COVID positive patients that are currently in the emergency department. They've been admitted, so they're receiving inpatient care, but they're waiting for a bed to open up upstairs. So that brings essentially our total COVID inpatients to 111, which actually puts us at number 1 in the state of California. There are close to 500 hospitals throughout the state of California. I was shocked to learn there are 92 hospitals in LA County alone, but Kaweah Health has the not so dubious honor of having the most number of COVID inpatients of any hospital in California. Community Regional Medical Center to the north in Fresno has the second highest. With respect to our ICU, 24 of those 111 COVID inpatients are currently in the ICU. We have 22 of those 24 patients are on a mechanical ventilator. And at 7:03 this morning, which is the time that our daily census email comes out, of our 21 medical ICU beds in the west side of the hospital, we only had one available bed. And then our new 20-bed cardiac ICU that's located in the Asequia wing, we only had two of those beds that were available. And definitely we're seeing more and more critical care level COVID patients. In terms of the number of our employees and providers that are currently out on COVID, this might be one of the few positive points that I share with you today, because fortunately more and more of our employees are recovering and returning to work. We've had 1,569 employees and 39 providers that have contracted the virus over the course of the pandemic, but we only currently have 39 employees that are out on a COVID leave of absence right now. 10 of them have been out on leave since last year, 2020, and we currently do not have any of our providers that are out on a COVID leave of absence. And then, but sadly, the death from COVID has not somehow escaped us. We definitely are not immune to it. In fact, healthcare workers are at higher risk of contracting the virus. We've had 4 of our employees that have passed away from COVID and 1 of our providers. We continue to be an incredibly busy hospital, so it's not just taking care of COVID patients. In fact, our hospital, the total inpatient census, 30% of our patients are COVID inpatients, or inpatients with COVID as their primary diagnosis, but that means 70% of our current inpatients are being treated in the hospital for something unrelated to COVID. But as of this morning, 329 of our 344 adult inpatient beds were occupied. That translates to about a 96% occupancy rate. But at the same time, we also had 35 patients that, again, had been admitted, but they're still in the emergency department, down in the waiting room or in an exam room, waiting for a bed to open up upstairs. And so when you combine those that are already in a bed and those that are in the ED waiting for a bed, that really is our true inpatient occupancy rate, and that is running at 106%, and pretty much has been consistently above 100% throughout this Delta surge, which began back in August. Our vaccination rates among our employees and our doctors does continue to climb. Among our 5,100 employees, those that are actually subject to the mandated vaccination, which means that any employee that works with patients or has contact with patients or walks through areas in which patient care is provided, they are required by law to be vaccinated. And so we are now at an 80% vaccination rate for our employees and 98% vaccination for our medical staff. So our physicians, physician assistants, nurse practitioners, certified registered nurse anesthetists. So I really commend our medical staff for really kind of setting the example. And then the last statistic I'll give, and it's the saddest, it is a grim milestone. We've seen across the world now, we've reported 5 million COVID-related deaths. We have 700,000 now in the United States, and Tulare County, at noon today, the county will officially announce that our county has now experienced 1,000 deaths, 1,002 to be exact, that are COVID-related. And generally, COVID-related is their death is primarily attributable to their COVID condition. So our hearts and our thoughts and our prayers go out to all of the families that have suffered the loss of a loved one from COVID. 1,000 lives is a tremendous amount of lost life, and I know it weighs heavily on our hearts, and we think about you all the time. So sorry I'm ending this segment on that sad note, but
Okay. Well, thank you. Thank you for that, Gary. So when talking about our census, and you reference this in the numbers, but can you let's clearly answer the question, are most of the hospitalizations that we're experiencing due to COVID-19, or are these patients in the hospital due to other illnesses?
yeah, so of the 364 adult inpatients that are in the hospital, again, either in a bed upstairs or waiting in the emergency department, as I mentioned, 111 of them, or 30%, have COVID as their primary diagnosis. And we try to cohort all of those COVID patients together. So, really trying to create separation between our COVID and non-COVID patients, because we certainly don't want to cross-infect healthy people or non-COVID patients with COVID. So, but that leaves 70%, or 253 of our patients that are here for just the normal illnesses and injuries that we take care of in non-pandemic times. So folks that have suffered heart attacks or strokes or experienced trauma, have had an injury. Sepsis is one of our most prevalent diagnoses for patients. That sometimes starts out as a simple urinary tract infection, but if it goes untreated, then the infection starts overwhelming the body and they end up in a septic condition. And the treatment of cancer, other respiratory conditions. Unfortunately, Tulare County has some of the worst health factors of any county in the state. So we have a very high prevalence of diabetes, congestive heart failure, chronic obstructive pulmonary disease, obesity. So oftentimes patients with those underlying conditions that is just exasperated end up in the hospital. We are, as I've said in recent telecasts, a bit befuddled by the intensity of the inpatient demand that we're experiencing, and the acuity of our patients is incredibly high, higher than we've seen it in many, many years. And the only thing that we can attribute that to, and what we hear across the nation, is we think there's been a lot of delay in care over these last 18 months, where patients are at stage 4 cancer and they're learning about it for the first time because they were afraid to go to the doctor or the hospital early on in their disease evolution. And so we just think a lot of those patients that had those underlying chronic conditions have just been putting off that care. So I do want to take a moment. I try to stay off of social media for the most part, but sometimes I get drawn in, and I'm just seeing a lot of comments about when they comment about the hospital's occupancy and the fact that only 30% of our patients have COVID. It's kind of like, see, it's not COVID. That's not the problem. It's only less than a third of a hospital's patients are COVID. But those admissions for COVID, those are entirely unavoidable. And I realize, living a very healthy lifestyle and what you eat and exercise and everything, could prevent you from getting diabetes or congestive heart failure and so forth. So I hear those arguments, but again, I'm a strong advocate of the vaccine, and I've seen how effective it is keeping patients out of the hospital. And 90 to 95% of our COVID inpatients are unvaccinated. And so I just imagine what our condition would be like if we did not have those 111 COVID patients hospitalized right now. There would be nobody waiting in the emergency department for a bed to open up. We would be at full staffing. Our surgical volume, our elective surgeries would be back to full steam. And so while COVID patients only represent a third or less than a third of our total patients, they are having a tremendous impact on the healthcare system, and something that really could be avoided. So I think it's important to keep that in perspective.
Yeah, so you mentioned the rise of acuity, but our ICU patients, that's been, we've had an extreme jump. Do we
Yes.
have available ICU beds?
As of this morning, we had 3, but we are now turning intermediate critical care units, so like 3 West and 5 Tower. We're now taking ICU patients into those units and turning medical surgical units into intermediate critical care units. So it kind of just cascades through. When we fill up all 41 of our designated ICU beds, then we start, having them flow into the ICCUs, and then ICCU flows into medical surgical. So we definitely are seeing more COVID patients end up in the ICU. Just yesterday, I was looking. We had 112 COVID positive patients in the house, and 26 of them were in the ICU and 21 on ventilators. And so I have to be careful here because obviously I'm not a physician. So I'm kind of guessing what may be the underlying cause. But the more I read, and unfortunately every day an email comes out that informs me and the rest of our executive team about the patients that have passed away the day before. And I'm particularly focused on those that died of COVID as their primary diagnosis, and particularly those that were vaccinated versus unvaccinated. Again, the vast majority, in the 90% area of those that die of primary COVID, are unvaccinated. There have been a few patients here and there that were fully vaccinated, but generally early on, back in December and January. Oftentimes they had pretty severe underlying comorbidities, oftentimes very elderly, and we've seen a few of them have passed away from COVID. But predominantly our COVID deaths are unvaccinated, and I think it's because this rise in ICU patients is, I think people are waiting too long to contact their doctor or to go to an urgent care center or go to the ED. So I think I mentioned earlier that in terms of a healthy oxygen saturation, so the thing that I'm seeing in these deaths is that they frequently come into the emergency department. They're hypoxic, which means that they have too little oxygen in their blood. Their oxygen saturation is fallen below 90%. Sometimes as low as 80% and 70%. And they've been at home. They might have had COVID for a week and a half, shortness of breath, and just getting worse and worse and worse until finally they come to the ED. They generally go straight to the ICCU, where they're put on BiPAP or CPAP, and they struggle even with that, with oxygen support. And then they end up in the ICU, and then ultimately they're intubated and put on a ventilator. And so I see that their oxygenation, again, just continues to deteriorate. Most of them, they actually come into the hospital with viral pneumonia that's been caused by COVID. Sometimes they come in with bacterial pneumonia. And so we're battling that. They infiltrates in their lungs, and so that's why I think more patients are ending up in the ICU, is they're just waiting too long. And so I know that when I contracted COVID back in mid-December, my wife and I have a pulse oximeter, which is that little device you put on the end of your finger. It's very, very inexpensive. And I was a worrywart, or she was more than I was, but just taking my oxygen saturation measure a couple times a day, I always stayed in the high 90s. And that was the thing I was most worried about. Am I ever going to have problems breathing? So I just really encourage people that certainly if you've been diagnosed with COVID, you've actually been tested positive, and you're staying home and you're taking care of yourself, get a pulse oximeter. And if you fall below 90%, call your doctor. Or go to the urgent care center, or go to the ED.
So yesterday, Kaweah called a code triage. What does that mean?
Yeah, so a code triage is kind of a hospital term that essentially means we're calling an emergency, we're calling a disaster. And a code triage could be because of an external event, maybe a major automobile pileup on the highway in heavy fog, and we're expecting a lot of patients to come in needing medical treatment. Once we hear about that, we would call a code triage. But it also could be an internal disaster. It could be a fire in the hospital, or a flood, or loss of power has happened on occasion. Yesterday's code triage was called because we were simply overwhelmed with patients. Particularly, we had more patients than we had staff to take care of. So at the time that it was called, it was 1:30 yesterday afternoon, and it's a judgment call. There's no formula or algorithm or any ratios. It pretty much, when we assess the conditions that we're operating under, and so myself, our chief nursing officer, our chief of staff, we generally are consulting with each other and our other physician leaders to make that decision. So at 1:30 yesterday afternoon, every single bed was full in the hospital, and we had 111 patients in the emergency department. We only have 73 exam rooms in our newly expanded ED, which is doubled in size in 2 years, but every single room is occupied. And of those 111 patients that were in the ED, 51 of them were requiring admission. So in fact, a determination had already been made by a physician that this patient needs to be admitted, they need to be moved upstairs. But we didn't have a single bed available. So, and we are continuing to be short-staffed. We have 175 open RN positions. Virtually all of them are bedside nurses. We have more than 100 contracted nurses that we've acquired through staffing agencies across the country. So it was just kind of the perfect storm. We do have physical beds, not many, but we have places, pods and areas, conference rooms and our endoscopy center, places that we can turn into patient care areas, but we simply don't have the staff to take care of them.
Mm-hmm. Okay, so what is that? What does a code triage mean for staff? We know what it means for patients. They're going to, sit there, possibly be diverted. So what does it mean for staff?
Yeah, so when that occurs, an overhead page goes out over our intercom system, and then all of us on our phones, we get a text that a code triage is being called. And so that's a signal to all of our leaders, myself, all of our vice presidents, our directors, were to immediately report to the incident command center. In this case, that's our conference room and our Kaweah wing. And so essentially, we as leaders, we drop everything. And we immediately go to that command center, we get briefed on what the conditions are, and then we start, basically proposing actions that we're going to take. We also immediately, it triggers the creation of a labor pool. So we have individuals who they know their role in the event of a code triage, that I'm in charge of managing the labor pool. So word goes out to all 5,100 employees across the organization that we need your help. And so those that can leave their post, essentially they report to the labor pool, and they're generally not nurses, but they're people that can help nurses. They can transport patients. They could, go get supplies. They're very important in that response to that code triage. It also, our medical staff, it rallies them, where they come together and they start looking at patients that we could discharge. And maybe the only thing they're waiting on is, or that would keep them, I got to get a test, a diagnostic confirmation to come back. Or this patient needs a walker, or some type of support. Maybe they need oxygen support. Maybe I'm not going to discharge them until I know that home health has already been arranged, or that a follow-up appointment with their physician has already been put in place. So we expedite those things so that we can discharge those patients earlier. So it pretty much, it just like, again, it's all hands on deck, and everybody, that becomes our singular focus. So so that's what happened yesterday at 1:30. Things have settled down a bit. I think when I came over here, we had 35 patients that are holding in the ED right now. And I don't know if you want to talk about staffing yet, but...
well, I have one more question
Okay,
about triage.
all right.
Okay, so you talk about how it affects patients, how it affects staff, how it
Right.
affects medical staff. Does it trigger something with the state? Like, who do we submit a code triage to?
Yeah, so not generally.
Okay.
It's, you know, every hospital, hospitals across the country, we all actually use a uniform disaster response program. It's called the Hospital Emergency Incident Command System, HICS. And so we all follow kind of a uniform approach, and we all use that language, code triage. But that's generally determined, you know, by individual hospital. But in this case, because of the nature of the disaster, and the fact that it's driven by this pandemic, which is nationwide, and the state has taken obviously a very prominent role in managing the disaster. We did in fact notify them both at the regional level and at the state level about our code triage, primarily asking for help, asking for resources.
Okay, before we go to resources, one more question about the triage. So if it's mainly internal, do we alert other hospitals in our area so that they can maybe prepare? Like if Sierra View knows, okay, Kaweah's called a code triage, they're in trouble, you know,
Yeah.
does that, are they part
Again,
of that system?
under pre-pandemic normal times, probably no, unless we felt that we were going to need their help. But in this case, we did. So we actually called pretty much every hospital in the valley here. We contacted Sierra View Hospital in Porterville. We spoke to Adventist Health, both Tulare, Hanford, Selma, Reedley. We called Community Regional Medical Center and St. Agnes in Fresno. And not so much to alert them, but literally asking for help. We were looking to be able to transfer patients, particularly those that are at that intermediate critical care level, looking to see if we could transfer patients to their facilities. And unfortunately, none of them had a single bed available to us. So they were aware. We put out a press release, so we did probably a much more public, communication than we might do otherwise. Because I think the thing that we're finding very disconcerting is, we've been battling this since early August. The condition got a little bit more intense yesterday, but we've been running at more than 100% occupancy, been short-staffed, severely short-staffed, had the highest number of COVID patients of any hospital in the state. That's been our condition really since mid-August. And it appears that the state was really unaware of that. They're looking at what's going on in the Bay Area and Southern California, and they're really breathing a sigh of relief and seeing the infection rates drop and hospitalization rates drop. But they're primarily looking at communities that have really high vaccination rates. They had no idea that we were still experiencing this intense, demand here in the Central Valley.
Okay, so now let's talk about staffing in the state. So what did we request from the state?
Yeah, we actually received almost 30 nurses from the state in early October. And we were very appreciative that they were able to secure them for us. They work through traditional commercial staffing agencies, but they're able to secure them for us. And in this particular case, they were deployed here for pretty much the entire month of October. And for the first time in this pandemic, the state actually paid the cost of those travelers, which again, very much appreciated, because generally we're paying $250 to $300 an hour to those staffing agencies. Most of those staff were pulled back by the state at the end of October. We put in a request for an extension, and we did receive, I think, a 2-week extension for about 8 of them. But Monday, so we hadn't, the code triage was called yesterday, but I guess, in anticipation, just watching what was building around us, we actually submitted an application to the state on Monday for 25 registered nurses in critical care, emergency medicine, mental health, and we just heard yesterday that those 25 were approved. And in fact, 17 are arriving today. So we're thrilled by that. It's kind of the cavalry, coming in. And so we'll onboard those 17 nurses between today and tomorrow and deploy them out into the medical center, taking assignments as early as tomorrow. So we're looking forward to those other 8 of that 25 arriving soon. But then yesterday, in direct response to the code triage, we made a request for 8 additional critical care nurses. So we haven't heard word yet on whether we're going to be approved for that one, but we're hopeful that it will.
Okay, so what would happen? What would happen if the state didn't respond and didn't assist with staffing? Would we have to close rooms due to staffing shortages? Or how does that work?
Yeah, well, in some respects, yes. So yesterday we were, among the many things that we were exploring and talking about, the first one that always comes up is, should we go on diversion? And diversion essentially means shutting down the emergency department. So we are the tertiary care hospital really for the 2-county area. EMS, the emergency management system, we're a designated trauma center, so essentially all the ambulances come here. But if you go on diversion, you essentially inform the emergency management system that your ED is closed. And so ambulances bypass here. So we were toying with that, but it's the last thing that we would want to do, particularly given that there were no empty beds around us. There are empty beds in the Bay Area and Southern California. Because they have a 70 to 80% vaccination rate. I think UCLA has 10 COVID patients and Cedars-Sinai has 12. They're single digit COVID populations in these highly vaccinated areas. So that's generally, we would have to transfer to there. So if we didn't get this staffing from the state, that we might be forced to do that. We're extending our existing staff to the fullest limits, and bless them. I tell you, they are truly superheroes. I do not know how they do it, but we are so grateful. They come to work every day with compassion and hope and commitment. They're working tons of extra shifts. They're working tons of overtime. And we also, under California nurse staffing ratios, depending on what unit you're on, let's say a general medical surgical unit, a nurse is only allowed to take care of 4, maybe 5 patients. And that's the limit. But because we're operating under these conditions, we actually have a waiver or an exemption from the state. So we're not required to adhere to those strict staffing ratios. So we're asking an RN to, take 1, 2, sometimes 3 additional patients, which puts tremendous, strain on them. But at the same time, we've hired many, many licensed vocational nurses, so LVNs and certified nursing assistants, more than we would normally staff, to provide them support, to do a lot of the tasks that a nurse would otherwise have to do. So making it a little bit easier for he or her to manage more patients.
Okay, so a question has come in from social media. Several months ago, the military came in and helped us. Do you see that as a future possibility?
I would love to see that. We had almost 30 healthcare workers, doctors, nurses, respiratory therapists that came from Travis Air Force Base, and they were arranged for us by Dr. Dave Duncan of the the Tulare Fresno County Emergency Medicine Services, that EMS. So we've been in discussions with him. I don't know if they're going to be available. We did actually, there was a strike team that was headed to Redding, I think from Southern California, and they were stopped and paused to potentially be redeployed or diverted to Kaweah. They're primarily EMTs that, staff ambulances, and we've had strike teams here periodically, but that it could be, and they kind of are super, medical assistants, not nurses, but they definitely can help provide impact support for us. So I'd love to have, the armed services come back again. They were great people to work with, but we haven't heard that that's going to happen.
Okay, so you mentioned this a few minutes ago, but you've also talked about it several webinars when you talk about transferring patients out. Have we done that? Have we transferred patients out? And if not, why not?
Yeah, we have tried on many occasions. We haven't been very successful at the local level because the whole Central Valley is pretty impacted, so there really haven't been beds throughout Tulare, Kings, and Fresno counties. So we've been looking to transfer patients again to the Bay Area, San Jose, Fremont, Monterey, Southern California, and in essence, it's voluntary. Patients and families have to agree to it, and for the most part, they haven't. They don't want to be transferred, and they're willing to wait in the ED in the waiting room. We have patients that sometimes spend 2 days in the ED. They're admitted at the very beginning, but it takes us a couple days before we can finally move them upstairs. So we've asked, and we've had a couple that have agreed to be transferred. I actually had the CEO of Salinas Memorial Hospital in Salinas, Pete Delgado, who's a friend of mine. He reached out to me last week and said, "Gary, I hear what's going on in Tulare County and Visalia, and what can I do to help? I'd be happy to take some of your patients. We hardly have any COVID patients, and Monterey County has almost an 80% vaccination rate." And I said, "Well, thank you, Pete." But as it turns out, they could only take medical surgical level, and we really needed intermediate critical care level. The CFO at Washington Hospital in Fremont, Chris Henry, also a gentleman I know well, he said they only had 4 COVID patients. They're in Alameda County, which is highly vaccinated. They only had 4 COVID patients, and they were running about 60% occupancy, and said, "We'd be happy to take your patients." So it's all voluntary right now, but if we stay in this condition much longer, or if it intensifies, then we would go to Dr. Karen Hott, who is the designated public health officer for Tulare County. And we understand that she could declare a healthcare crisis, a public safety crisis, where she could institute mandatory transfer, so that you did not have to obtain patient or family consent to transfer a patient, that they had to accept that transfer. And so that's the last thing we want to do. We want to keep patients and families in their own community, and we're going to do everything we can to preserve that. But that'll depend a lot on just the changing conditions.
Right. Okay, thank you. So let's move on to vaccinations. We had a vaccination clinic at our Tulare clinic a couple of weeks ago. Do you know how many people we vaccinated on that day?
Yes, we had 43 newly vaccinated residents of Tulare County, and thank you, Kiki, for partnering with us. He is an incredible young man. I just watched the commercial that we filmed with him, He was the only member of the U.S. boxing team to get vaccinated.
Oh.
And yeah, so it's a great commercial. There is, I think, just a 30-minute clip, but we're also going to post a longer version, a 2-minute clip with him on social media, and you'll get an appreciation of just what a great young man he is. And he definitely is advocating vaccination. And so, yeah, we were excited that 43 people got vaccinated.
Yeah. So we have a social media question. How is the hospital implementing the vaccine mandate, and how are your staff members responding to this?
Yes, so we're a very compliant organization. We're not all about civil disobedience, but we certainly had some folks that were encouraging us to march on Sacramento and express our defiance, and but we chose not to use our energy there. So we did, certainly accept the governor's mandate that he issued back in July. At the time, California, and he as its governor, was the only state in the United States that was mandating vaccines for healthcare workers. So it became essentially law that we had to start testing our unvaccinated employees. I think it was August 23rd. And then by September 30th, you either had to prove you were fully vaccinated or have received at least one dose of the Pfizer or Moderna vaccine, or had received the single dose of the Johnson & Johnson. So you had to do all of that to be considered a vaccinated healthcare worker. But you could choose not to get vaccinated by filing an exemption from vaccination, and you were allowed to request an accommodation or an exemption for either a medical reason that was supported by a physician, or a sincerely held religious belief. And so if you declared one of those conditions and you filed that declaration, then you would be exempt from vaccination, but you would be subject to COVID testing. Mm-hmm. And depending on what position you're in, if you're in the direct patient care position, you're tested twice a week. If you're in a non-direct patient care, it's once a week. And so if you chose not to get vaccinated and not to submit an exemption, then you would be terminated. But we did not have any employees that were terminated. We did have one employee that did not want to be vaccinated and did not feel that they could submit an exemption. That employee did leave Kaweah, and I think moved to Texas, if I'm not mistaken. So we had a choice to make in terms of how severely we wanted to test the employee's reason for exemption. And I'll say that 98% of them were for sincere religious beliefs. And so I've heard of hospitals that actually have formed religious scholarly committees, and they actually have the employee come meet with that committee, and they're interviewed, and they have to demonstrate and convince this committee that they truly have a sincere religious belief. We chose not to do that, largely because of our fear that we would have a lot of critically important healthcare workers quit the workforce here, something that we could not afford and still provide care to our community. And so we took kind of a don't ask, don't tell approach. If the employee declared it, checked the box, signed the form, and submitted it, then we accepted it. And we have about 1,000 of our employees that submitted bona fide exemption forms, and so they're all on file, and those employees are compliantly being tested as they're required to, and if somebody tests positive, they're immediately put on quarantine. If they test negative, they come to work, but they continue testing. And so we will do that, until we're told that we don't have to do it anymore, which we hope that happens soon in our future. But maybe contrary to what you've seen on social media, we have not terminated any of our employees. We've not threatened any of them with termination. We've been very, very accommodating, and we've only had one employee that essentially left, not because they were terminated, but they just they didn't want to get vaccinated, and they didn't feel that they could honestly, state that they had a sincere religious belief, and so they just chose to leave.
All right, thank you. So do we vaccinate our hospitalized patients that request a vaccine?
We do not while they're hospitalized, and unfortunately, and we hear this so often, is those that are admitted for COVID, are pleading for a vaccination. I've changed my mind. I've learned, but at that point you can't vaccinate them.
Yeah.
Those that are not in for COVID, we don't vaccinate them in the hospital. But we can certainly make them aware that when they're discharged, how they can be easily vaccinated through our many vaccination sites. We are considering doing it for patients that come into the emergency department. Again, those that are appearing for non-COVID related reasons. We're looking at potentially the Johnson & Johnson vaccine, which is the single dose, so that we could administer it to patients that come to the ED. But still very easy to get vaccinated. Just go onto the kaweahhealth.org website. You'll see the My Turn link, and you go on there and you can literally schedule an appointment at any of our 5 rural health clinics, our urgent care centers, our Kaweah Health and Wellness Family Medicine clinic right next to the helipad. You can get tested for COVID, and you can get your vaccines, you can get booster shots. So really encourage folks to do that.
Okay, so with the recent announcement from the FDA and CDC regarding Pfizer's emergency use approval, that we can now administer the vaccine for children ages 5 through 11, do we have a time frame when that is going to be available to that age group at our clinics?
Yes, and so talking to James McNulty, our director of pharmacy, we're thinking that within the next couple weeks we'll be able to operationalize being able to vaccinate children 5 to 11 years old. It'll certainly be based on product availability, but we have placed orders for it. It's a smaller dose from Pfizer. So you can't use the same dose that we got and just give a little bit less. It's formulated specifically for children in that smaller dosage. So it also will have to go through our P&T, or Pharmaceuticals and Therapeutics Committee, just like every medication, and even the mix and matching, everything all has to be approved by a clinical committee here at Kaweah, and we fully expect that they're going to give that approval. So we're probably looking at a couple weeks.
Okay, thank you. So social media, is Kaweah Health administering monoclonal antibody infusion treatments, and if yes, does the treatment physician refer their patients to you?
Okay, thank you for giving me that
that
forewarning. I had to do a little research on this. So yes, we are providing outpatient monoclonal antibody treatment to patients that are positive for COVID and meet certain criteria. It requires a doctor's order, so you would need to contact your physician who would write the order for that. Right now we're doing the Regeneron, that's the name of the company. It's called Regen-Cove is the actual name of the medication. It's given subcutaneously, which means under the skin. So it's actually an injection, a one dose injection. that is given in 4 different areas of your body, all under the skin, between the skin and the muscle, which it doesn't go into your bloodstream. They give it subcutaneously so that the body absorbs it a little bit slower. And generally, you have to wait there for, I think, about a half an hour to just monitor to make certain everything is going well, though. So we currently, at our Kaweah Health Specialty Clinics, where we have our infusion center, it's right on the corner of Willis and Mineral King on that southwest corner. We, on Tuesdays from 4 o'clock to 8 o'clock p.m. Is where we administer the Regen Cove. We can treat it, from James, it looks like about 30 patients a week, but right now we're only seeing about 7 to 10 patients per week. So we certainly have capacity to see more patients in that 4 to 8 hour time, 4 o'clock to 8 o'clock time frame on Tuesdays. And you have to, because I'd actually looked into it, or it had been suggested to me, you have to receive it within 10 days of the onset of symptoms. So you can't wait too long. Actually, the sooner the better in seeking that antibody treatment.
Is there any other criteria? Because I know you have to meet criteria. So besides the 10 days?
Yes, there's also, generally underlying conditions. I think there is an age. I'm not positive, but there are criteria, and again, your doctor may be aware of those. You certainly can reach out to Kaweah, and we'll provide that to you. And I know when I went on the Regeneron website, it lists the criteria that it's intended for. Also, out at Kaweah Health Medical Group, so out on Hillsdale, the former Visalia Medical Clinic. I'm sorry. It is Kaweah Health Medical Group, but we're doing this at our Ben Maddox urgent care site. So the Kaweah Health Ben Maddox Clinic, which is on Tulare and Ben Maddox, they're doing Regeneron treatments from 9 a.m. to 1 p.m. on Saturdays, but you have to be an established patient of the Kaweah Health Medical Group. So if you're a patient of Visalia Medical Clinic out on Hillsdale, or our clinics in Tulare, or any Kaweah Health Medical Group clinic, then you're eligible for that Saturday. And then I also heard that Dr. Baz, who's an allergist, I think he's over off of Fairway and Sunnyside, right off of Mooney. It's an allergy clinic, but he's doing Regeneron treatments 5 days a week. So I just learned of that today, so I don't know much about it, but I think if you go onto his website, you'll learn more.
So at our clinics, at the Kaweah Health Clinics, just to remind everybody, this is not a walk-in procedure.
No.
You have to have.
You have to have a physician's order. You have to have an appointment. Yes, it has to be a lot more scheduled.
Yeah. Okay. Thank you. So Gary, off the subject of COVID, community members have been asking us about Kaweah Health's policy on social media with our employees. It's very disheartening, of course, when we see our employees maybe speaking negatively or speaking out of turn about COVID or the hospital. And so they want to know what our policy is around social media.
Right. Yeah, I mean, we certainly respect everybody's First Amendment right to free speech, and we often learn about these postings from community members, which is, I think, how we learned of a recent one, and it's always disappointing and sometimes disconcerting to see our employees post negative or derogative, remarks about our organization, or post misinformation is always troubling. And we will generally, speak to that employee and caution them about, harming the reputation of our organization or their personal reputation. We can't make them stop. We can't necessarily prevent them, but you can cross the line. And so that would generally be on a case-by-case basis where they'd actually be disciplined for literally crossing the line. And that's happened in the past. But
we don't forbid our employees.
No.
It's not a rule. There's
not a rule,
policy.
and I don't know if a company can have such a rule.
Right.
Because what you do on your own time, and again your own freedom of speech, you would hope that an employee would not speak. That they if they have criticisms of the organization, if they have things that they're not happy with, things we could do better, please come talk to us. Come talk to me. Or give us an opportunity to address that, as opposed to posting it out on public media.
Okay, thank you. So final question, how difficult is it on our staff when we're experiencing so much COVID-19 here, but the rest of the county and the rest of the world, it almost seems to be under the belief that COVID is going away and they're just resuming life as normal or as usual without precautions?
Yeah, it's frustrating, no doubt about it. Our staff are exhausted, despite, again, coming to work every day and putting on their boots and their N95 masks and gowns, and again, they're a remarkable team, but they're exhausted and they want this to end. That's why they do get frustrated when they see so many unvaccinated people, knowing that really widespread vaccination in our county is, in my mind, the only thing that really is going to bring this to an end. We can't continue to be under siege as a hospital, as a healthcare system, that eventually our staff will just wear out. And so, I think, they're perplexed that why just us, and in some respects they feel like forgotten. And we were feeling that. We had a conference call with the Hospital of Northern and Central California recently, and as we told our story, as we told our condition, every other hospital was slack-jawed. I mean, they couldn't believe it. They had no idea that we were experiencing what we were experiencing, because none of them are. It really does appear, when you just look at it at the state level, it does appear that this thing is really dying off. And but in those areas that have very low vaccination rates, it's not. In fact, it is subsiding slightly here, but it is still at an incredibly high intensity because of also having so much non-COVID demand that we're experiencing. But I did a couple television interviews this morning, news interviews, and they were asking me, is there anything you want to ask of the public? And I said, don't forget, about our nurses and our doctors, and your gestures back in December and January, where you were sending them thank you notes and marching around the hospital with your signs of encouragement and dropping off snacks or buying lunch for a group. I can't begin to tell you how much that meant to the staff, how much it lifted their spirits and morale and just energized. So as we approach the Thanksgiving holidays and give thanks for all our blessings, our healthcare workers are one of the most important blessings we have in our lives in the community right now. So that will help them continue on. So.
I was really excited when this question came in, because we're actually kicking off a 31 days of holidays here at the hospital. And I reached out to several service organizations this week and said, we're collecting items, and gave them a list of things that we're collecting so that we can hand out to large amounts of our employees here at Kaweah Health during the holidays. So if you're a community member, you're a part of a service club, or you're a part of an organization and you're saying, what could I possibly do for Kaweah Health, reach out to me, because we have some ideas that are in the works right now. We're wanting to just lift up our staff in the month of December. So I have some great ideas, and I would be more than happy to share those with you.
Yeah, I'll give a shout out to Scott Stubbs. He's the head pro at Visalia Country Club, and just out of the blue, I got an email from him. I think it was earlier this week, and he said, "Gary, we're thinking about all of you at the hospital, and with Thanksgiving coming up, and I know there's going to be thousands of employees that work on Thanksgiving Day, and is there anything we could do to show our support?" And he said, "How about if I send out 50 Thanksgiving dinners with all the trimmings and everything, and bring them to the hospital?" So thank you, Scott,
That's
for
awesome.
that, and all the
Yeah.
members at Visalia Country Club. That again, that will be so appreciated by our staff.
All right, thank you, Gary, and that wraps up our time. So let's go ahead and close it out.
Yeah, I'm right at 1 o'clock, huh?
You double checked
Stuck the
me.
landing.
You
Yes.
didn't believe me.
Okay. Well, again, just as I opened, just want to thank again all of you for joining us, our community engagement folks. You've been here loyally every couple weeks, and I really appreciate you being here and then becoming spokespeople for the organization and helping folks stay connected and answering questions. And please, the things you learn on this, and we'll publish all the written answers that'll be accessible to you, but definitely share them with your friends and family and community members. We've always said that we want to be the source of truth throughout this pandemic, and that's what you'll get from us, is always the truth. And if it's an opinion, we'll tell you it's an opinion. But we definitely we want to have a well-informed community, and you're a vital part of that. And then others in the community, if we have anybody from the media or just the general public that joined us, thank you for doing that, and we appreciate you tuning in and again getting information. And feel free to reach out to us anytime you have a question or concern, you're hearing something out there. Unfounded rumors and misinformation are really both dangerous and very unhelpful right now, frankly. So, but thank you all, and I hope you have a wonderful weekend, and we'll see you back in a couple weeks.